Hi everyone. These sessions were extremely familiar feeling for me as I've been in therapy and counseling for 20 years. The room was not distracting, did not have a ton of images on the wall that allowed for the focus to be on the session rather than outside stimuli. The ability to feel physical comfort in a setting will indefinitely correlate to the comfortability within the session. In the brainstorming session, the counselor was very thoughtful in bringing up topics that the client had spoken about previously, allowing the client to steer the conversation and delve into underlying feelings and emotions. The session seemed very casual and conversational, which I think can be very comfortable for some clients because they do not feel as if they are being analyzed on what they say or how they say it. This counselor used a number of reassuring and understanding counselor skills to create a comfortable environment in which the client felt safe to look deeper into the issue troubling him. Turning the session into a relaxed exchange can allow for more freedom where the client is comfortable and willing to self-analyze. In the homesick session, the counselor used a lot of encouragers and attentive silence to let the client examine her stresses of being homesick and gave a description of what emotions she was experiencing. This promoted a great deal of introspection for the client. She reiterated and validated the client's feelings, and she left room for the client to express herself without directing her too intensely. The counselor took a non-directive approach by allowing the client to explore her feelings on different topics pertaining to her homesickness. In the dancing or helping session, this session mirrored the most realistic first-time client interaction to me. The client admitted to feeling nervous, but freely admitted that she has trouble expressing her emotions verbally as opposed to being able to express them through dance. The counselor seemed very confident in reading her social cues and remained neutral. He used the reflection of feeling and reflection of meaning when discussing her confusion about what to do with her dance degree. All counselors used open questions and encouragers, which I believe helps build a rapport with the client to allow them the freedom to speak, but to also feel that they are being heard first and foremost. I would say that they were most different in that all of the counselors had different types of body languages in their sessions. In the brainstorming session, the counselor was extremely energetic and enthusiastically conversing with the client. In the homesick clip, she used more silent encouragers such as a lot of head nodding and leaning forward. And in the dancing and helping clip, the counselor seemed the most relaxed and natural to me. He appeared to be sitting comfortably and open so that the client could feel that she was in a safe space. My question is, how does a counselor determine which approach to use for a client in handling their sessions? Clearly, there is an assessment stage and a treatment planning stage, but what is an example script for addressing these? Is it a natural assessment or is it a more formal and direct assessment? Thank you.